Hello, everybody. We've got, it's a small group here, so feel free to ask any questions along the way. My name is Dr. DeLuca, and I'm a professor at the School of Pharmacy at Wilkes University in the Department of Pharmacy Practice. And thank you so much for coming. And I hope that this is something that you enjoy, something that you learn from, and feel free at any point in time to ask any questions. Let me go to the next slide. There we go. This session is being recorded. And so if you want to ask a question, the easiest way for you to ask a question is to use the chat box, because from the view that I have right now, I don't have a picture of all of you since I'm sharing my screen. So the best way to ask a question is to use the chat box. Once I stop sharing my screen, then it'll be easier to see everybody there, and I'll be able to see it if you raise your hand. There is a little button on Zoom where you can, the emotions where you can raise your hand, but I may not see that when I'm sharing my screen. If you do use your video for any of the questions that you ask, just know that it'll be included in the video recording of this session. But I encourage you to ask any questions, and I've got the chat box open. So I welcome any questions that you have, okay? So just a little bit about me as an introduction. I've been at Wilkes for a long time, probably longer than all of you have been alive, I'm guessing. Since around 2002, I've been at Wilkes. Before 2002, I was a hospital pharmacist, and my specialty was in taking care of patients that were critically ill. So these are patients in intensive care units. They might have been in intensive care because they had a heart attack or a stroke, or maybe they had pneumonia. And so that was my patient population that I specialized in. My research that I've done has been in patients who have undergone heart surgery or cardiac surgery, and specifically looking into, well, what's the role of the pharmacist in improving the outcomes of patients who undergo cardiac surgery? And then my research most recently has been in the transitions of care. You all may know some people who had a transition maybe into the hospital and then out of the hospital. And during those transitions, there's a lot of opportunity for medication errors. There's a lot of new meds that are started or some meds that are stopped. And the role of the pharmacist in improving the safe use of medications was a focus of my research, and that also a focus where students participated in that research as well. So we're going to start by talking about heart disease, how to fix a broken heart. It's a real complex topic, and we're not going to get into the broken heart with relationships, but we're going to talk about the literal sense of a broken heart. Heart disease is the #1 cause of death in this country. And the primary thing that everybody can do is to reduce their risk factors. And we'll talk about what those risk factors are. Also, understanding what are the warning signs of a heart attack and know what to do if those warning signs occur. So let me ask you, and just kind of put it into the chat if you want to, what do you think are some of the risk factors for having a heart attack? Let's see in the chat. Some risk factors for a heart attack. Any ideas? Do you guys see the chat button on your screen? It's probably on the bottom of your screen. If you take your cursor to the bottom of the screen, mine is coming up on the top, but here is, for me, there's a little button over here called chat, but for you, it would be on the bottom of your screen. If you put your cursor down there, you might see a chat button. Do you guys see the chat button? Somebody throw something in the chat just so I make sure that you guys know how to do it. I'm going to start one off. Here's a chat. You guys see the chat? There we go. Excellent. All right. Thanks. So smoking, age, yes. So smoking increases your risk of having a heart attack. And the older you are, that also increases your risk of a heart attack. Excellent. Thank you. Are there any other risk factors that you guys can think of? High cholesterol from Liz. Thank you. Yep. High cholesterol is another risk factor. Good. Any others that you guys can think of? Diabetes absolutely is a risk factor. Stress, you guys are excellent. Great. Stress is another risk factor. Good. So let's think about risk factors in terms of, I'm going to put this over here. There's things that we can change and there's things that we can't change. So on the left, we can't change our age. We're all getting older and we would love to change that, but we can't change it. And we also can't change our genetics. So our heredity, the things that we inherit. Sometimes heart disease is in your family history. Actually, in most people, heart disease is somewhere in your family history. We can't do anything about that. But there are things that we can change. So a lot of the things that you all mentioned are things we can change. Smoking, it's not easy to quit smoking, but you can quit smoking. And there's a lot of tools that a pharmacist has that can help patients to quit smoking. There's a lot of different strategies, and pharmacy students are trained to help people quit smoking. They're trained to teach people how to do that and help them through that process. High cholesterol, there are different things that the students learn that we can do to help people with high cholesterol. There are different medications that patients can take for high cholesterol, but there's also other things you can do besides taking medication. There's things you can do with your diet and exercise that can help to lower your blood cholesterol and decrease your risk of having a heart attack. High blood pressure is another risk factor. And just like high cholesterol, the pharmacy students learn how to counsel patients on what they can do to lower their blood pressure. It's not just about medications. There are other things that we can make changes to our lifestyle to improve our blood pressure and lower our risk of not only a heart attack, but also a stroke. High blood pressure is the #1 cause of stroke. So physical inactivity, so that's another thing that we can do. That's a risk factor we can change. Obesity and being overweight. So helping the pharmacy students learn how to counsel patients to work on their diet and to kind of come up with a plan for weight loss if that's something that the patient needs. Well, you might think of diabetes as something that we can't change. How we manage our diabetes is very much something that we can change. And the pharmacy students learn how to counsel patients to improve the management of their diabetes. There's a lot of things that patients can do to improve their blood sugar control and decrease their risk for having heart disease. So it is something that we definitely can have a positive impact on and help patients get a better handle on their diabetes management. Stress, like Morgan mentioned, and also alcohol is another risk factor for heart disease. And we want to encourage patients to have moderation in drinking alcohol. So some warning signs of a heart attack. Some signs are chest discomfort, and everybody's going to explain this differently. It could be described as a pressure, like something sitting on your chest. It could be described as a squeezing feeling, a fullness. Some people describe it as chest pain. It could be in your upper body. It could be in one or both of your arms. Some people feel it in their back, their neck, their jaw, sometimes even their stomach. Some people go to the hospital with pain and they think they're having a heart attack, but sometimes it's just stomach pain. but it's really hard to distinguish, and people can describe it different ways. Some people are going to be short of breath, kind of have, feel like it's difficult to catch their breath. Some people are going to start to sweat. They might feel nauseous, like they're going to throw up, and they might also feel lightheaded. So a lot of different potential signs, and it can be different in different people, and some people don't feel any of these signs. A lot of people think that it's really just men that have heart attacks, but women also are susceptible to heart disease, and heart disease accounts for 1 out of every 2.4 deaths in women. In general, it occurs in women just as much as men, but women tend to be older in age when they have a heart attack. Men can be younger when they have a heart attack. There are younger women that have them as well, but in general, it happens more commonly in older women. So this statistic of heart disease can be compared to breast cancer, which accounts for 1 out of every 29 deaths in women. So what do you do if you see these warning signs of a heart attack? So I'm going to throw out a poll here. What do you do for these warning signs? I'm going to launch this poll. If these warning signs occur, do you A, rest, B, call your doctor, C, drive to the hospital, D, have a friend drive you to the hospital, or E, call 911? What do you think? There we go. And I'm going to share the results. So we have call your doctor, 1 person saying that, and 2 people saying call 911. And it's, it's not necessarily clear. Like, I think a lot of people don't really know what to do when you have a heart attack. And this is one thing that pharmacists need to counsel their patients about, especially people that have risk factors for a heart attack and their family members and their caregivers. It's not a bad idea to call your doctor, but you definitely want to call 911. And so the first thing you want to do if those warning signs occur is you want to call 911. It's okay to call your doctor after that point. It's important that if an ambulance can get there, that you go in an ambulance to the hospital. And the reason for this is because there are a lot of things that can happen while you're having a heart attack that the ambulance, the paramedics can treat you with. So you want to avoid having to drive to the hospital or having somebody else drive you to the hospital. You want to call 911 and get to the hospital in an ambulance. So let's see. We're going to talk now about how to prevent the heart attacks, and prevention is a lot easier than treatment. So we already talked about the risk factors, and when we think about prevention, we really want to think about some of the basics. We want to think about our diet and what can we do to eat a healthy diet? What can we do to increase our activity level and get some exercise? We want to have some moderation with alcohol use, and we also want to encourage people to quit smoking if they are smoking. There's a lot of other tobacco products. There is chew, there is pipe smoking, there's cigarette smoking, there's vaping. While we have the most evidence about cigarette smoking, there are also a lot of risks associated with other forms of smoking or tobacco or nicotine use, such as vaping. There are a lot of risks associated with vaping as well. So we want to encourage people not to do any kind of nicotine with smoking or vaping. We also want to take care of our health. So if we have high blood pressure, we want to encourage those patients to monitor their blood pressure. And there are certain goals that we want to get to, and we want to help them achieve their blood pressure goals. We want to think about the stress in their lives and what can we do to minimize that stress. And there's a lot of strategies that we can do, such as meditation and yoga and exercise, that can help with stress levels. Getting enough exercise, and also if patients have diabetes or pre-diabetes, there are many things that we can do to take care of our health to optimize the management of those disease states. So we're going to talk a little bit about when prevention fails, and believe me, it's way easier to prevent a heart attack than it is to treat. But when a heart attack does happen, how do we treat it? What do we do? So this is a picture of an artery in your heart. And if you remember, arteries are the blood vessels that deliver blood and oxygen to the heart. And that's what keeps it beating. Okay, this delivers the nutrients and the oxygen that the heart needs in order to continue to beat. So on the left is an artery that is nice and clean. And on the right is an artery that has buildup due to plaque. And this plaque builds up based on, it can build up with high levels of cholesterol, but even people with normal cholesterol levels can have plaque buildup in their arteries. This is also builds up based on our diet, our exercise, and things like that. So in the top picture here, you have blood moving through a nice clean artery, and it moves freely. In the middle picture, you see that this plaque is starting to build up, and there's a narrowing here. And so the blood doesn't really move freely through that artery. There's a narrowing, and it has to go around that. And what can happen is, as that blood goes across that plaque, what you can have is you can actually cause damage to that coating of that plaque. And once that happens, it can rupture, and you can have a big blood clot basically right here in your coronary artery, in the artery that supplies your heart. When this blood clot happens, none of the blood flow is getting past this big blood clot. So all of the heart muscle that's being supplied by this artery is no longer getting blood, and it's no longer getting oxygen. So if you have a blood clot, let's say right here on your heart, okay, if the blood clot happens here, then all of this heart muscle right down here, that's not getting any oxygen, okay? So that heart muscle is starting to die. And that's when people start to feel the symptoms of a heart attack. So how do we treat it? What do we do when we have a blocked artery in the heart? There's three main things that we can do. The first is we can do what's called stenting. We can put in a cardiac stent or a heart stent. We can do what we call coronary artery bypass grafting. This is a more complex surgery. It's also called CABG, for C-A-B-G. And then third we have some medications that are known as clot busting drugs, and they can open up that artery and improve the blood flow in that artery. So first I'll focus on the stenting part of it. And so stenting happens in a place called the cardiac cath lab, and this is what it looks like. And the patient would lay on this table, and then there's this big arm that kind of goes around the patient to be able to visualize inside the heart. And so the patients are given dye. They're injected with dye into their blood, into their arteries, and that dye, you can visualize it in the heart. So this is actually a picture of all of the arteries in a patient's heart. So when you inject this dye, it lights up, and so you can see all of the arteries in their heart. And then if a patient has a blockage, so there's dye here, and then there's a little bit of dye here, but you can see that there's nothing going on here. And so this is an area that has been partially blocked, okay? There's still some blood getting through, but it's not as much blood as is needed. And so when you put in a stent, here's before the stent was put in, and now here's after a stent was put in, and you can see that now this lights up with dye, meaning that the blood is flowing through these arteries much better now, So that's what stenting does. And so this is a picture of a stent. This is the end of a finger. And so this kind of gives you an idea of it kind of, you know, can fit on the tip of your finger. It's very, very small. It's like a little smaller than the little coils you see inside your pens. So this is a picture of one, and they are little metal stents, okay? And the way we do this is that if this is the area on the heart that is blocked, the stent is on a catheter, and the catheter goes, we advance the catheter through your arteries, okay, into your heart artery. And so we can see this when we have that big C arm in the cardiac cath lab, they can see where the stent is. So they advance it right into your artery that has the plaque buildup, okay? There's a stent, and then on the inside of the stent is a balloon. If you blow up the balloon, if you push air into that catheter and blow up that balloon, that expands the stent and it kind of mashes it into the walls of the artery. And then when you deflate the balloon, the stent is made of a material that stays open. So when you deflate the balloon, the stent is not going to close up. It's going to, once you open it up, it stays open. So they deflate the balloon and they remove the catheter, and the stent stays in the heart, in the artery, and keeps it open. Okay, so that's how stenting works. And so here's a picture of stenting before a stent and now stenting after a stent. And you can see that the blood flow is increased after the stent was placed. So the second option that I talked about was the CABG surgery, the coronary artery bypass grafts. And what this does is it bypasses the blockage in your coronary artery. So let's say you have a blockage right here, okay? There's two different ways you can bypass it. You can take what we call a saphenous vein. And so if this is a vein that is taken from your leg. You don't need all the veins in your leg. So you take out part of the saphenous vein and you move it to the heart. The surgeons will make an incision in the leg, and then they apply one end of the saphenous vein to the aorta, and then the other end to just past the blockage. And so you basically are supplying blood now from the aorta to all this heart muscle that's beyond this blockage. Okay, so it bypasses. You still have the clot in that coronary artery, but you bypass it. You make a bypass route around it so that the heart muscle gets blood and oxygen down here. And so that's a saphenous, that's a vein graft. There's also, you can use some arteries. You can use an artery from your arm, which is the radial artery. So this is illustrated in red. You could take out the radial artery from your arm, attach one end to your aorta, and the other end just past the clot. So you can use that as your bypass. And then there's also another artery within your chest cavity called the internal mammary artery. And you can use that as well to bypass the blockage. And so this is just another picture. Here's the bypass. Here's where the clot is. Here's where the heart attack happened. And then here is where blood is bypassing this and going from the aorta directly down here. And it's then supplying this part of the heart muscle with blood and oxygen. Okay, so just another picture of that. During this surgery, some patients have the surgery done where their heart is beating throughout the surgery, so they don't have to be put on a bypass machine. But other patients are put on this, what we call a bypass machine. It's basically does the work of your heart and lungs while those bypass grafts are being put in. So it pumps your blood and oxygenates your blood while you're in surgery. So depending on the surgeon and the type of heart surgery you need, patients might be on the bypass machine, or their heart just might continue to beat throughout the entire surgery. So if they stop your heart, then your blood is routed through this machine, which pumps it and oxygenates it. So it does the work of your heart during the surgery. And then at the end of surgery, your heart is restarted, okay? So that is the heart-lung machine that is used in some heart surgeries. So I had mentioned before that my area of expertise in research was in heart surgery. And so this is just an example of a study that I had published. My former name is Christeller, and that's why it's in there as Judith Christeller. But these other names, Teresa and Tierra, these were pharmacy students that worked with me on this research. And we looked at this medication called sodium bicarbonate. And we looked to see if that was effective at preventing injury to the kidneys that can happen during heart surgery. And so I'm just giving you an example of some research that students did with me and had a publication as a result of participating in that research. And I'll show you later on how we have many students, many of our pharmacy students participate in research with faculty members and can be a part of different poster presentations and publications as well. So I gave you two options. We talked about stenting and we talked about cabbage surgery. The third option is using a medication to kind of bust the clot. These are clot busting. These are called thrombolytics. Lysis means to lyse or to break apart a blood clot. Thrombo means the thrombosis, the blood. And so this is probably the least effective method of opening up a blocked coronary artery, and it also has a significant amount of risk in terms of bleeding. So this is a third option, but it's used the least frequently of all three of the options. So when all of this is happening, when somebody is having a heart attack, there are other medications that we use to keep them safe and to improve their chances of surviving their heart attack. So patients are at risk of having abnormal heart rhythms or arrhythmias. And this is a big reason why you want to call an ambulance if somebody's having a heart attack, because the paramedics can treat some of those abnormal heart rhythms. And those abnormal heart rhythms can cause death. So we give medications and do certain things to prevent these arrhythmias or abnormal heart rhythms. We also give medications to prevent pain because pain causes stress and that can increase the work that your heart has to do. So we want to keep everybody calm and we want to treat their pain. We also give medications to prevent blood clots. You can have more blood clots in your heart causing another heart attack. So we can prevent recurrent heart attacks, but you can also have blood clots in other arteries and veins in your body. And so we give medications to prevent those. And we also want to give medications to prevent death. And pharmacy students learn what medications can be used to improve patients' chances of surviving their heart attack. And they also understand the evidence behind those medications. So they understand what research has been done to demonstrate that these certain drugs are effective at improving your chance of surviving. So hopefully you're getting the sense that prevention is way easier than treatment. So, and that's why pharmacists, it's really important that they educate patients about risk factors and how to reduce their risk factors. It's also important that pharmacists counsel patients about the medications that can decrease their risk of a heart attack. And counsel them about their lifestyle changes that they can make to reduce their risk. So prevention is way, way easier. There are medications that pharmacists counsel patients, and pharmacy students learn how to do this, counsel patients to lower their cholesterol. There are medications that can lower blood pressure, medications that can prevent you from having another heart attack if you've already had one. There are also medications that are super important if a patient has had a stent put in their heart. There are medications that they need to take to prevent a blood clot from forming in that stent. And there's also medications that can improve heart function. So pharmacists counsel patients about reducing their risk factors, how to take care of those underlying problems like high blood pressure and diabetes, how to recognize the warning signs of a heart attack and stroke, and what to do if those warning signs occur, and the importance of taking their medications as directed. And pharmacy students learn how to counsel patients to do this. Pharmacists can work in community settings like your chain pharmacies like CVS and Walgreens. They can work in independent pharmacies. They can work in hospital settings. Here's a picture on the left of a pharmacist on rounds with other physicians and nurses talking about the patients, and the pharmacist is part of that team in making recommendations for how should we treat this patient. What are the best medications? Do we need to change the medications? Do we need to discontinue any? Do we need to adjust the doses? Is the patient tolerating them? So the pharmacist is part of the healthcare team in hospital settings, and also pharmacists work in physician offices to manage patients with disease states like diabetes and high blood pressure and lung disorders. So pharmacists work directly with physicians in their offices to manage patients with chronic diseases to decrease their risk. So I also mentioned that some of my research was in improving the transition from hospital to home. And what is the pharmacist's role in that? And I had many students work with me on this research, and we focused on providing education to not only patients, but also their caregivers. When patients leave the hospital, there's a lot to learn about their medication changes and also their lifestyle changes. So we focus a lot on talking to patients about that. We also help patients with access to their medications to make sure that they can afford them. We assess the medications to make sure that there's benefits and risks that are explained to the patient. And we want to make sure that we understand what's important to that patient, what are their priorities, and what are their concerns with their medications. We can work to prevent medication errors and also to prevent hospital readmissions. And so that was the focus of the research. And this is an example of a poster that was presented at a national conference by 2 other pharmacy students that were involved in our research, showing how we identified medication errors and how we prevented those medication errors. So this was just an example of a poster that was presented. And some of these pictures are pictures of our former students that are now pharmacists. And these are pictures of them presenting their research at a national conference. This is Kristen. She just finished 2 years of a residency. This is Heidi. She's a pharmacist in Wilkes-Barre. This is Emily and Elena and Corey. And all of these students presented their research at national conferences they worked on their research with faculty members. This is from a couple years ago, and this is just a big group of students. This was in, I believe, in Nashville, Tennessee a couple years ago. We usually have a pretty big group like this, and of students that are presenting different posters about their research. All the faculty have research ongoing, and all the faculty work with students to involve them in the research as well. So we've had students do research on a lot of different topics, some on helping patients to be more adherent to their medications. These are just some examples. Students have done research and posters on insulin, the safety of insulin for patients with diabetes, providing care in community settings like in community pharmacies like a CVS or Weiss Markets, students have done research on naloxone, which is a drug that you can use to prevent opioid overdose. They've done research on foods that have anti-cancer benefits, and also research on kidney stones. That's a focus of research of one of the faculty members. So that gives you a little bit of an overview of heart disease, how we do to treat a broken heart, the importance of prevention, the role of pharmacists in helping patients with this, as well as what pharmacy students do to get involved during their experience in school and to get involved in research. So at this time, I'm happy to answer any questions that you have. And I'm going to stop sharing my screen so that if you want to ask any questions, I'm happy to answer any of those. Do any of you know anybody with heart disease or have any family or friends that have heart disease? What led you to working in a hospital compared to other settings? Morgan, thanks for the question. I love that. Is that a, it's not a cello, is it it's a bass, right? I'm not sure what you call that, but I love that picture. What led me to working in a hospital compared to other settings? So I just was always drawn once, I didn't know I was gonna go into a hospital setting before pharmacy school, but in your last year of pharmacy school, you do, it's a base, thank you, yeah. In your last year of pharmacy school, you do different rotations in different settings, and I absolutely loved my experiences in the hospital setting. I really liked being a part of the team. I really liked rounding with the physicians and the nurses and kind of being a part of the decisions. We made, we were part of the decisions like which antibiotic is right for this patient, and this patient is going to be started on a new medication. Can you go in and counsel them about that medication? So that really appealed to me when I was a student. And so I just always kind of looked for jobs in hospital settings, and I've never looked back. I absolutely love being a hospital pharmacist, and there's so much opportunity in that setting to not only work with doctors and nurses, but also to work directly with patients and to kind of be that first person to kind of help them adjust to anything, any changes. When people go into hospitals, because something big has just happened. Either they just had a heart attack or a stroke, or they had pneumonia, or they had their diabetes got worse. And so it's a really nice opportunity to go in and counsel them about, all right, this was a life-threatening event and you survived it. And what can we do moving forward to keep you out of the hospital, to help you to stay healthier? So I really love that opportunity for patient interaction, as well as being part of the team that makes the decisions on how patients are treated in those acute, those acute scenarios where they're really, really sick. It's also, there's also opportunities in, if I had to do it all over again, I really love ambulatory care settings now. I don't know if many of you are from this area, but we have a lot of collaboration with Geisinger, and they have pharmacists in their doctor's offices managing patients with high blood pressure. So the patients make an appointment to see the pharmacist, and they come in and they get their blood pressure checked, and the pharmacist is able to make adjustments to that patient's blood pressure regimen. Also the same thing for, they manage patients' diabetes. They manage their pain management. They have pharmacists in many different settings in Geisinger. So that's another area that is really a great opportunity to do more than just dispensing a medication. It's really a nice opportunity to sit down and have a major impact. But also in community settings, there are community settings where you're going to see pharmacists doing mostly dispensing, but there's also community settings where pharmacists are interacting with patients and counseling them and talking to them about their smoking, their blood pressure, their vaccinations. So in pharmacy school, students learn, no matter what the setting is, they learn how to provide patient care. The actual process of dispensing a medication is a really minor part of it. It's a very important part, but it's not the primary issue that students learn what to do. They learn how to provide patient care regardless of what healthcare setting they're in, whether they're at CVS or in a doctor's office or in an independent pharmacy or a Weiss pharmacy or a hospital setting. What other questions do you have? Any other questions? Well, I'll hang out here in case you have any questions. I'll be hanging out here for another 10 minutes or so. I really appreciate that you came to this, and I hope you learned something. I hope you enjoyed it. And it was certainly my pleasure to talk to you, and I'm happy to hang out for any questions that you might have. I'm going to stop the recording, but